Hello, this is Dr. Mukta Nadig, Senior Consultant Obstetrics and Gynecology in the Cloudnine Hospitals in the Malleshwaram branch. Okay, now how do we go about diagnosing the cause of the abnormal uterine bleeding in a particular woman? Before giving a list of diagnostic tests to the woman, I would lay emphasis on a careful history taking and a detailed physical examination, which would involve a general and a local examination. Now, a meticulous history taking can give us insight into many causes of the abnormal bleeding, such as coagulopathies, which would give us history of frequent episodes of gum bleeding, frequent bruising, surgery-related bleeding, and also a family history of unusual bleeding. In physical examination, the general, we would find a patient who is obese, hirsute, with a lot of acne, and would direct us towards a diagnosis of polycystic ovarian disease. In a local examination, we would look for any growth which could be benign or malignant in the genitals, that is in the cervical area, which would point to a cervical malignancy. After having done a detailed history taking and careful examination, then we go to the tests which are ordered to the patient. These would include certain lab tests, that is a complete hemogram, a coagulation profile, and if needed, a thyroid profile and a hormonal profile to clinch the diagnosis of polycystic ovaries. After doing the tests, the imaging tests are very important in the diagnosis of the structural causes of abnormal uterine bleeding. The imaging tests are the ultrasound, a basic pelvic ultrasound, which would tell us about the uterus, the adnexa, and the endometrial thickness. Then a 3D ultrasound, which would give us more details about the myomas, the mapping of myomas and the intracavitary lesion. The Doppler ultrasound would pick up the AV malformations and the details of the malignancies. And in this, we are also helped by MRIs and saline infusion sonography. Hysteroscopy would also be a very important diagnostic tool in this manner. Endometrial sampling, which is mandatory in a woman aged 40 years and above to rule out malignancy, and also below 40 years if the endometrial thickness is 12 millimeters or above.